I'd like to invite Yara Abulwafa and Samy from Carm Build, a company that is associated with Carm Solar.
I'm very happy to be introducing Samy again, as today we're having for the first time someone from actually outside of the healthcare sector, and now we'll try to understand how are they using their innovation for a core thing of the healthcare sector. So Samy, can you give us a brief about what is, I'm not sure, I would think some people here wouldn't know Carm Solar or Carm Build, so if you would give us a brief about it.
Yes, of course. Hello, everybody. Ramadan Kareem. Wishing you all well. I'm Samy Awa, and I run marketing and communications for two sister companies, Carm Solar and Carm Build. Quickly, I'll tell you a little bit about them. Carm Solar is an energy utility company. Some people in the industry consider us a startup. We as well. Basically, what we do is we provide solar energy solutions across the board for many different industries, industrial, commercial, retail, agricultural, and even residential buildings as well. We build, own, operate our own stations, and we generate, distribute, and sell energy across the board to anyone who needs it, on grid and off grid as well. That's Carm Solar, but the company in the spotlight here today, and with the project that I'm here to speak to you about, is our sister company, Carm Build. Carm Build is a unique type of architecture and design firm that specializes in sustainable architecture and efficient environmental design. The whole premise of Carm Build is utilizing materials and processes to develop new kinds of structures that are ergonomically developed for specific environments to complement and not disrupt spaces. This is the company. Should I get straight into the project? Well,
yeah, can you tell us how did you end up being here today on a healthcare webinar?
Okay, yeah, it's quite the place to be. Okay, so what happened was that the leadership of Carm Solar, Carm Build, as the COVID-19 situation progressed around the world, being a company that's run by primarily paranoid germaphobes, we were looking for how to best ensure the safety of our employees and what sort of processes we should take into consideration or start adopting, while also, and most importantly, how can we support our community, our country, anyone who requires the need, using our expertise in fighting or combating the spread of COVID-19, or supporting patients or the healthcare infrastructures of the world with coping and treating COVID-19. So while we're doing the research and taking into consideration the kind of the expertise of Solar and Build and where our knowledge lies, we came across this very interesting example of an architecture firm from Italy, Carlo Rotti Associati. It's a very prominent architecture firm in Italy that produced a model or designed a model for a mobile ICU response unit that is capable of being built and deployed in any situation, primarily as an addition to hospitals to increase their ICU capacity. The model is very innovative, it's very ingenious. It's built out of refitted shipping containers. It includes 3 ICU beds, and this is basically a design profile for this innovation. As I said, it is a mobile ICU unit that this is its layout. It connects to an existing healthcare facility to increase its ICU capacity. So once, and this design was pushed out and it was adopted by the Italian government because they had a very big problem with ICU capacity. As you know, Italy faced a very difficult battle against COVID-19 as well as its healthcare infrastructure. So this solution was adopted by the government and implemented in healthcare facilities. So while we're doing our research and we came across this example, this was a perfect example of where Carm Build expertise lies. We're talking about unique types of structures with unique sort of dynamism and modular design that are easy to build, that are easy to construct, and constitute a fast and easily rapidly deployed solution for a problem like ICU capacity. We took the time for the last couple of months to compile a team of collaborators that involve members of healthcare representatives of the hospitals, construction engineering companies that have worked on developing or building healthcare facilities before. And we launched an initiative that we called the رعاية مصر Initiative لإنشاء المستشفيات الميدانية لمكافحة مرض COVID-19, or the رعاية مصر Initiative for combating COVID-19 with the design of temporary ICU field hospitals. This is the hospital, by the way. If you guys can see it, I think I'll minimize this. If you guys can see, this is the layout of the hospital. I'll walk you through it a little bit more about the details of what we did here. But when we're talking about the objectives here of building a ICU hospital, this is where we're talking about. I think this paragraph here explains it the most. And we were talking about 4 main objectives or 5 main objectives for the construction and design of this facility. First of all, it has to abide by certain specifications and regulations for a facility that can manage the spread or manage the curing or the treatment of
infectious disease.
Yeah, exactly. The spread of a highly infectious disease. It takes a specific type of facility to be able to manage this, and abiding by these guidelines and making sure we design a facility that can actively and progressively combat and secure the spread of this disease within the facility while treating its patients was the first objective. The second main objective here is about the speed and the feasibility of developing this solution. So field hospitals are not necessarily supposed to be a very rapid response solution for an entity or a country that is facing immediate danger. And this hospital or this design being a fast mobilization and the construction for the facility or being rapidly deployed as a solution was one of our main objectives. This is why we've managed to develop an architecture design and construction methodology that can be executed between 10 and 15 days. So of course, fast mobilization and construction was the second point. So it has to be really quickly. You can really quickly develop it. And the second point is that all the materials and resources that you require to build this hospital must be available locally sourced. So the objective was to develop the design that is modular. And by modular, we mean that there will not be a one-size-fits-all solution or space for a 3,500 square meter facility to be deployed anywhere. So the design, which is, again, you can see here, is actually designed in a way that any of these wards, whether the triage, the actual ICU or U wards, the management facility, even the morgue and others, can be repositioned and respaced to fit many different types of sizes, and can even be expanded into double, triple, and even quadruple the size of this hospital.
And I think we have an important thing to say here, that that you have done this as an open source. So actually, anyone who would like to see it, replicate it, is there. It's there online on the website.
If you want to visit it, you can download the entire architecture, design, and methodology for the hospital. It's egyptcarehospital.com. Thank you very much for your time, everybody.
And I think it's a great example from an innovation from outside of the industry on how they're using their best skills to deploy it to healthcare. But anyone who has been involved in building a hospital knows how much partnerships it takes, and how many people from different parts, from engineers, designers, architects, healthcare planners, healthcare professionals need to be there to actually make it happen. And this is the first step for it.